Thanks, Nick. Yeah, just to give everybody a bit of context, Counties Manukau Health has a whole range of different community health services that cover a large geographical area in South Auckland and operate out of multiple bases and have approximately about 150 allied health clinicians based within them. So moving to sort of a level 4, community allied health still had to focus on essential service delivery, but do it in as contactless way as possible. So one solution of that we decided was going to be telehealth. The foundations that we had to build our telehealth capability on were somewhat shaky, to say the least. We did have community teams who were in a good position already in terms of they were already able to work remotely and in a mobile way and had technology and IT systems already in place to enable them to do that. Some teams were already using Zoom as a clinical tool. So, for example, our speech language therapists were using Zoom to do video fluoroscopy reviews between clinics. However, we had no policies or procedures or guidelines or anything like that. And, you know, being DHB, we love our policies and procedures. We had very variable levels of comfort in terms of some people just wanted to pick up telehealth and run with it, and some people did not want a bar of it. And what we found was over the first week or two of lockdown, where people were using it more and more for Zoom meetings, remote MDTs, virtual huddles, all those kind of things, people did begin to feel more comfortable with using the systems. We also just recently appointed a telehealth lead who was part of our Healthy Together technology team, and she helped in terms of the growth of telehealth during our COVID-19 response to develop policies specific to the different services. The guidelines we used were ones that were developed by either the Occupational Therapy Board or the Dietetics Board, because they had the most recently developed guidelines and were more fitting to the COVID context. And we did have support from project managers to help increase people's comfort with using the technology so they could get familiar with the platform and then in turn teach patients and families how to use the platforms. There was a lot of clinician-led development of resources to guide patients and families to assist in navigation of things like Zoom. And there was also a lot of development or sourcing of resources that could be shared through a screen share or could be used as a video link. And we also started to just naturally develop into our usual processes things that took account of the growing use of telehealth. So obtaining email addresses at triage and things like that became a much more standard practice than it ever had been before. Obviously, there were a lot of challenges of implementing something as fast as we had to, but there were also quite a lot of successes. So in the essence of time, I'm just going to talk about the things that we want to keep. So for those community teams who have an in-reach function, they're going to continue to assist people to download Zoom and prepare them for virtual consultations prior to discharge from the hospital. We're going to continue using Zoom for advice, education, talking therapies, and things like fatigue management strategies, that kind of intervention. Physios are going to continue using it for simple balance programs where there are family members in the home who can assist. Our speech language therapists are very keen to carry on using it for people with mild to moderate communication impairment, where they're doing things like reading comprehension or naming tasks, and can do that through sharing a screen and annotating and things like that. They're also keen to use it in terms of their reviews of swallow and oromotor exercises. We're definitely going to continue growing the resources that we use virtually, and particularly those that assist with or monitor patient's own self-management. We're going to continue using it where we have, in a consultation kind of way, where we have one therapist in the home and maybe one zooms in for a portion of an intervention to provide advice and assistance and then zoom back out again. And we'll definitely be growing our ability to get more creative with the way that we're using the technology. I think the future focus for us, just to finish up, is going to be looking at the evidence and the data about the quantity and the quality of the interventions that we're delivering now in this new way.